Welcome to the Dr. Maya podcast, where we challenge the norms of healthcare, empower people to take control of their health, and redefine the future of medicine.
Life was given to us 1 billion years ago. What have we done with it?
My name is Srivatsa. I'm a doctor, author, and creator of Dr. Maya to introduce patient-centered care, which will revolutionize healthcare.
Today I'm talking about clinical acumen. What is clinical acumen? It's basically a judgment, a good judgment, and you have to take it fast. This happens every day in your life as a doctor, as a chemist, as a nurse. In all walks of life as well. But it is very important in healthcare. Why? Because the patient might die and there's nothing you can do. You don't have the time. So you have to decide who needs help, who doesn't, who can wait. And this discrimination is one of the toughest things any doctor can do, because everything looks like common. Cough, fever, sore throat, headache. Everybody suffers this. Certainly not. There will be at least about 20% of the people having a serious illness with the same symptom. You are sitting in the chemist shop dispensing drugs. People come there thinking you have the knowledge. Oh, I've got a headache, what do I do? Oh, take paracetamol and go. He goes home with the paracetamol. 48 hours later, he was found dead because he had a severe stroke, an intracranial hemorrhage. How do you deal with this? It's okay, he's dead and gone. I'm not worried about it. But you, I'm worried because you have to cope with this. I have done that all my life. I declare death because I'm the one who takes the decision. Yes, no more resuscitation. It's a hard decision to make. The church called me and said, "Can you give us a talk?" I said, "What is it about?" "You play God." I said, "No, I don't play God. I just resuscitate people." He said, "No, you are the one who declares death." It's a huge responsibility, and that is very important. So, clinical acumen. So why do you need this? Because tomorrow you want to be facing infections which we don't have a cure for. So how are you going to identify that? How are you going to identify it's infected? What are you going to do with it? You're going to get infected. It happened in 2015. Majority of the people who died were people like you and me, who tried to save people or help them, and then I'm dead. So we need to develop this strategy where we can. It's all to do with today's talk. If you go home with a conscious mind and think, I can cope with this. I'm not going to get hurt. I'm going to live. And I'm also going to make sure that the patient is also going to home happy and safe. So my job now is to protect you and protect me. Till I came here to talk, Ashim called me last year. And when I came here, I realized it's not me should be worried about. It's not the nurses I should be worried about. It's not the hospital I should be worried about. I should be worried about the chemist, because you are the gatekeeper. Everybody comes to you first, not me. They come to the chemist, Boots. Oh, I've just got this cough, I've got a rash, I don't know what to do with it. And the poor chemist over there, not being trained, is advising the patient. Oh, you can put on this cream, this is a good one. Why? Because her auntie had this steroid cream, which was very good, so it got it better. Gives one steroid cream, but no white. What happens? The rash flares up. It's like putting kerosene on fire. Steroid suppresses the inflammation, increases the infection. And that's going to happen, it's already happening. So you need to know how to protect yourself and make sure the patient is also protected. Intuition. Einstein, my great teacher, I say, because he's helped me to understand myself. Intuition. What is intuition? It is basically a gut feeling. You see somebody and you suddenly start thinking, there's something wrong with this fellow. You don't know, but the hunch, I call it, is very important. So many times people ask me, you walk into the intensive care and you say this child is going to die. Half an hour later, the child is being resuscitated because the heart rate stopped. How did you know that? I said, I don't know. I didn't have a clue. But I was able to do that. Why? Because I was getting the intuitions. Something is not right. I felt uncomfortable. And then acted upon it. And that is what he said. Intuitive mind is a gift from God. It's a gift from universe. The rational mind are the ones who follow it. Yes, I did create a guidelines. I collected 100 cases of upper respiratory tract infection, tonsillitis associated with streptococcus infection. Out of that, I found only 8 out of 10 had streptococcus, whereas 20 didn't. This was what we were doing in 1980s to find out whether we are doing the right thing. UTI, which is the commonest antibiotic, which is the commonest organisms. So we created a guidelines for ourselves to make our job easier, better, so that the patient is not going to go home with wrong antibiotics, treated wrongly. What happened? E. coli, 70%, 30% something else. And the 70% responded to trimethoprim, the first drug of choice, trimethoprim. Yes, somebody stole our idea, created what is known as evidence-based medicine. And they created another thing called NICE guidelines. And the NICE guidelines, National Institute of Clinical Excellence. What does it tell you? It's an excellent institution in the world. So the whole world now, in the last 10 years, following these footsteps, have made a major disaster. We had MRSA in 1980s, 1990s. Allowing that to multiply has resulted in losing 18 bacteria, 28 antibiotics, viruses and fungus have become resistant. Why? Because they were all treated with the wrong dose, low dose, not necessary dose. Everybody who came to the clinic got a prescription, trimethoprim. All 3 have gone now. We don't have 3, only 3 which work on E. coli is gone. Nitrofurantoin, I used to shit bricks, I would say, when I prescribed, because it had so many side effects. I don't want to make a young girl with a UTI to go home with nitrofurantoin. Now that is the only drug left, I believe. What's going to happen if that runs out? Will you be sitting next to the toilet all your life because you have urgency of urination? What kind of life are we going to lead? So it is very important, intuition. So that's what he said, rational mind just follows. So when we did that, because our intuition, the rational mind is following like puppets, parrots, not thinking. I was in India 3 weeks ago working on one of my projects, and there was dengue fever. Everybody is thinking, oh, dengue fever, no problem, kill the mosquitoes, you'll be all right. No, you're not going to be all right because they multiply every 24 hours. So, if you go into a hospital because you have a cold, you come home with dengue fever. Why? Because there's another person with dengue fever sitting there. A mosquito has a very good population. It just sucks blood from a dengue fever fellow, comes and gives it to you. You are in trouble. So I was scared to get up. And there's another, in my native place where I was born, it's called Udupi. I wanted to go and see my grandmother. I couldn't because H1N1 was spreading like wildfire. There's a medical school there from all over the villages. People were coming H1N1 and they were spreading amongst themselves. Maximum death was happening there. Overnight, 1,500 cases of H1N1. Where are you going to mobilize the care for these people? I wrote in 1996, everybody comes to us with a symptom of an illness as they remember and as they have experienced. It is our duty to listen to it and offer a solution, not a prescription. The pharmaceutical company wants to crucify me, the health authorities want to crucify me, hospitals want to keep me and bury me in with no stones left. Why? Because they all depend upon you going to the hospital. They all want us to prescribe. Medicine is not a branch of prescription. It is a branch, which is a service offered to humanity to offer them help, alleviate pain and suffering. We never cure anything. Have you ever come across any drug which cures anything? Is there anybody who's got an idea? Any drug which cures some illness. Yes, we did have one antibiotic. Now it's gone. Even the malaria drug doesn't work. There's no guarantee. 50%, not 100% like it used to be. So that's what I meant. Listen and offer a solution. And everybody is blaming GPs. Basically because they are saying everything is a common illness. And then we have to keep the common illness people at home. So I asked this question, what is a common illness? Because every common symptom which patients has, there is 10 to 20% of the people with the same symptom developing serious problems. Sore throat can be an early sign of leukemia. So sore throat is not just tonsillitis. Now it is predicted by 2050 more people will be dying than cancer and all the illnesses put together with infection. And nobody talks. Everybody is scared. Yeah, what do we do? What do we do? You have to think, be logic. Can't bring in emotions into it. Yes, my daughter might die tomorrow. But if I bring the emotion into it, what am I going to do? I can't find a solution. But we need to find a method to prevent that happening. I'm saying, if you go to Brixton, you might get mugged. Why? Because there is knifing, stabbing going on. People are hitting one another, shooting one another. So please don't go there. Yes? You're sitting here, you don't know what's happened in Arden Center last week. And then you don't listen. No problem. I am going. Yeah, you please go. But you're the one who's going to be in trouble, not me. So I told the politicians, this is going to be a disaster. We cannot allow unethical medical practice to continue. In fact, I challenged pharmacists prescribing drugs. I challenged nurses prescribing drugs. Because prescription is not the criteria. The most important thing is to identify the cause. If you are unable to diagnose a condition, how can you prescribe anything? I think 10 times before I prescribe any drugs. If I am supposed to take amoxicillin for sore throat, I'll probably pop in like that, no problem. But if I have to advise somebody, I think 100 times. Because that can produce side effects, that can have consequences. Now, superbug development is much higher if I give an antibiotic. So, you have to be very careful what you advise. If it happens to be somebody else, not you. So, this is what I did. NHS is telling everybody, all the children must be taken to chemist if they have flu. What? Fever, coughs, colds. I mean, children are one of the most difficult patients you can deal with. I must have been crazy. I worked with children for 20 years. It's like veterinary science. They don't tell anything. First, you need to find out who is the patient. Because is the mother who is worrying or is the child ill? If the mother has psychiatric problems, she thinks the child is going to die if she's paranoid. So, you have to first identify mother and the child, and then you have to address both the issues. It's not only treating, giving prescription or take it to home, go, no problem. So that's what happens. So I challenged. Then I didn't get anywhere. So what do? I pray God. He said Dalai Lama. So he comes and signs my book and says, God bless you. Whatever it is, I've done what I can. But now my duty, my job is to educate everybody, including the patients, you, the nurses, junior doctors, to understand what prescribing drug is all about and what are the consequences.